You wake up in the morning, swing your legs out of bed, and stand up, only to feel like someone has strapped weights to your ankles. Walking to the bathroom feels like wading through thick mud. By the afternoon, climbing a single flight of stairs leaves your legs feeling tired and leaden. And by evening, all you want to do is sit down and put your feet up because your legs feel so incredibly heavy. If you're over 60 and experiencing this, you're far from alone. Heavy legs are one of the most common complaints among older adults, yet it's something people rarely talk about with their doctors. They assume it's just part of getting older, something they have to accept and live with. But understanding why your legs feel heavy can help you address the underlying causes and, in many cases, get significant relief. Let's start with what's actually happening in your legs. That heavy, tired feeling is usually the result of multiple factors working together, and they all become more pronounced as we age. The first and perhaps most significant factor is venous insufficiency. Your veins have a tough job. They need to move blood from your feet all the way back up to your heart, fighting against gravity every step of the way. To accomplish this, your leg veins have one-way valves that open to let blood flow upward and close to prevent it from flowing backward. When you're younger, these valves work efficiently, but over time, they can weaken and become less effective. When the valves don't close properly, blood can leak backward and pool in your lower legs. This is called venous insufficiency, and it's extremely common after 60. Some studies suggest that up to 40% of people over 60 have some degree of venous insufficiency. When blood pools in your legs, several things happen. The veins become swollen and stretched, kind of like overfilled water balloons. This increases pressure in the veins and pushes fluid out into the surrounding tissues, causing swelling and that characteristic heavy feeling. Your legs might also ache, throb, or feel tight, especially at the end of the day. Think about it this way. Imagine your legs are like buildings, and your veins are the elevators carrying people, or in this case blood, from the ground floor back up to the top. If the elevator doors don't close properly, people start backing up on the lower floors. The lobby gets crowded and congested. That's what's happening in your legs when you have venous insufficiency. The second major factor is muscle loss. This is something we call sarcopenia, the age-related loss of muscle mass and strength. Starting around age 30, you begin losing muscle mass, about 3 to 5% per decade. But after 60, this process often accelerates, especially if you're not actively working to maintain your muscle. Your leg muscles do more than just move you around. They also act as a pump for your circulatory system. When your calf muscles contract, they squeeze the veins in your legs, helping to push blood upward toward your heart. Strong, active muscles make this pumping action much more effective. Weak muscles don't pump as well, which means blood flow slows down and pooling becomes more likely. Additionally, when you lose muscle mass, you often lose some of the structural support for your veins and blood vessels. The muscles literally help hold everything in place and keep it functioning efficiently. Without that support, circulation becomes less efficient. Your activity level plays into this as well. Many people become less active after 60, whether due to retirement, health issues, or just changing habits. But when you sit or stand still for long periods, your leg muscles aren't contracting regularly, which means they're not pumping blood effectively. The blood has a tendency to pool, and that heavy feeling develops. Interestingly, both sitting for too long and standing still for too long can cause heavy legs. When you sit, gravity pulls blood down into your legs, but your muscles aren't working to pump it back up. When you stand still, the same thing happens. Movement is what keeps blood flowing. Inflammation is another contributor. As we age, our bodies tend to develop more chronic, low-grade inflammation. This is sometimes called inflammaging, a combination of inflammation and aging. This inflammation can affect blood vessels, making them less elastic and less efficient at moving blood. It can also affect the tissues in your legs, contributing to that heavy, achy feeling. Carrying extra weight compounds all of these issues. Excess body weight puts additional pressure on the veins in your legs, making it even harder for them to push blood upward against gravity. It also means your heart has to work harder to circulate blood through a larger body, and your leg muscles have to work harder to move you around. The combination of increased demand and decreased efficiency makes heavy legs more likely. Certain medical conditions can worsen heavy legs. Heart failure, where the heart doesn't pump blood as efficiently as it should, can cause blood to back up in the veins, including those in your legs. Kidney disease can lead to fluid retention throughout the body, including the legs. Lymphedema, a condition where the lymphatic system doesn't drain fluid properly, can cause significant swelling and heaviness. Medications can also play a role. Some blood pressure medications, particularly calcium channel blockers, can cause fluid to accumulate in the legs. Hormone treatments, certain diabetes medications, and anti-inflammatory drugs can also contribute to swelling and that heavy feeling. Dehydration might seem counterintuitive, but it can actually worsen heavy legs. When you're dehydrated, your blood becomes thicker and doesn't flow as easily. Your body also tends to retain whatever fluid it has, which can lead to swelling in the legs. So what can you do about it? The good news is that there are many effective strategies, and most of them are simple changes you can make on your own. Movement is absolutely crucial. I can't stress this enough. You need to keep your leg muscles working to pump blood back up to your heart. Walking is one of the best activities you can do. Even a 10 to 15-minute walk can make a noticeable difference in how your legs feel. If you can walk for 30 minutes most days of the week, even better. If walking is difficult, try other forms of movement. Swimming or water aerobics are excellent because the water pressure actually helps push blood up from your legs while you exercise. Cycling, whether on a regular bike or a stationary one, is also great for leg circulation. Even simple ankle pumps, where you flex and point your feet while sitting, can help. The key is to move regularly throughout the day. If you have a sedentary job or spend a lot of time sitting, set a timer to remind yourself to get up and move every hour. Walk around for a few minutes, do some leg exercises, march in place. Just get that blood flowing. Elevate your legs whenever you can. Elevation uses gravity to help blood flow back to your heart, instead of fighting against it. When you sit or lie down, prop your legs up so they're above the level of your heart. You can use pillows, a footstool, or a recliner. Try to do this for at least 15 to 30 minutes several times a day, especially at the end of the day when pooling tends to be worst. Compression stockings can be remarkably effective. These are special socks or stockings that apply graduated compression to your legs, meaning they're tightest at the ankle and gradually looser as they go up your leg. This compression helps squeeze the veins and push blood upward, preventing pooling. You'll want to talk to your doctor or a specialist about the right compression level for you. Compression is measured in millimeters of mercury. Mild compression is 15 to 20 millimeters. Moderate is 20 to 30, and firm is 30 to 40. For most people with heavy legs from venous insufficiency, moderate compression works well. Put the compression stockings on first thing in the morning before swelling develops, and wear them throughout the day. They might feel a bit strange at first, but most people adjust quickly and find significant relief from heavy legs. Stay hydrated. Aim for 8 glasses of water a day, more if you're active or in a hot environment. Proper hydration keeps your blood flowing smoothly and can actually help reduce swelling, even though it might seem like drinking more water would make swelling worse. Reduce sodium intake. Excess sodium causes your body to retain fluid, which can worsen swelling and heavy legs. Try to limit processed foods, which are often very high in sodium, and be mindful of how much salt you add to your food. Instead, flavor your meals with herbs and spices. Maintain a healthy weight. If you're carrying extra pounds, losing even a modest amount of weight can significantly reduce the pressure on your leg veins and improve circulation. You don't need to achieve some ideal body weight. Even losing 5 to 10% of your body weight can make a noticeable difference. Strengthen your leg muscles. Remember how muscles pump blood back up to your heart? Stronger muscles pump more effectively. Simple exercises like calf raises, leg lifts, squats, and lunges can help build and maintain leg muscle. You don't need a gym membership. Body weight exercises or simple resistance bands work fine. Avoid crossing your legs when you sit. This can compress veins and restrict blood flow. Keep your feet flat on the floor or on a footstool. Massage can help. Gentle massage, stroking upward from your ankles toward your thighs, can help move pooled blood and fluid out of your legs. You can do this yourself or ask a partner to help. Some people find that a handheld massager or a foot and leg massager machine provides relief. Consider your sleeping position. Try elevating the foot of your bed slightly, just 3 to 6 inches, by placing blocks under the bed frame or using a wedge pillow. This gentle elevation throughout the night can help reduce overnight swelling and make your legs feel lighter in the morning. Review your medications with your doctor. If you suspect a medication is contributing to swelling or heavy legs, don't stop taking it on your own, but do discuss it with your healthcare provider. There may be alternatives that don't have the same side effects. For women, consider the role of hormones. Fluctuations in hormones, particularly around menopause, can affect fluid retention and vein function. Some women find that hormone replacement therapy helps with heavy legs, though this needs to be carefully discussed with a doctor considering individual risk factors. Pay attention to temperature. Heat can cause veins to dilate, which might worsen swelling and heavy legs. On hot days, try to stay cool. Cold therapy, like cool compresses or a cool foot bath, can help constrict veins and reduce swelling temporarily. Watch for warning signs that require medical attention. If your heavy legs are accompanied by chest pain, severe shortness of breath, or one leg is significantly more swollen than the other, seek immediate medical care. These could be signs of a blood clot or heart problem. If you notice skin changes, like discoloration, ulcers, or thickening of the skin on your legs, see your doctor. These can indicate more advanced venous insufficiency that may need treatment. Some people benefit from medical procedures for severe venous insufficiency. These include sclerotherapy, where a solution is injected into problem veins to close them, or laser therapy to seal off damaged veins. These are outpatient procedures with minimal recovery time and can provide significant relief. The important thing to understand is that heavy legs after 60 are not something you just have to accept. They're a sign that your circulation needs some support, that your muscles could use some strengthening, or that your habits might need some adjustment. With the right approach, most people find that their legs feel significantly lighter, more energetic, and more comfortable. Think of caring for your legs as a daily practice. Move regularly. Elevate when you can. Wear compression if you need it. Stay hydrated. These aren't complicated or time-consuming interventions. They're simple habits that, practiced consistently, can make a dramatic difference in how you feel and how well you can move through your day. Your legs have carried you through life. Now that you're over 60, they deserve a little extra care and attention. Give them that support, and they'll continue to carry you well for many years to come.